we speak about unfunded and or underfunded priorities in 2026-2027 financial year. The major underfunded and unfunded priorities under the health sector include, among others, inadequate staffing in various public health facilities. The average national staffing levels are at 33% based on the new staffing norms or culture. This, I should clarify, we've been having the old staffing norms, but recently the ministry came up with a new structure which is not yet implemented. So when you compute the current staffing levels and you use the new staffing norms as the denominator, it gives you a low percentage. That's how we get 33%. For instance, Health Center 4, the provision has been 39 workers. This has been increased now to 150. That's what I was being told. There were 49 in the old staffing norms. Now the new structure, 150. So now when you get the current staffing and you divide it by 150, then the proportion becomes very small because of that. But if you use the old staffing norms, we are better than 33%. But definitely understaffing is one of the challenges that we have. And I speak to the positions, I speak to the amount of money that we need. We need 756 billion to increase the staffing levels to at least 45%. So we need resources. And it's a challenge you will find in your constituencies, the hospitals, health center for inadequate staff. And like I said earlier on, even failing to attract specialists in our hospitals. Number two, that the lower level health facilities needed to be equipped with anesthetic machines for a period of 5 years. In financial year 26-27, 11.9 billion shillings.
Cloud hosting for you, whoever you are.
Check it out.
Infrastructure projects, medical buildings, staff houses, among others. Most of these buildings and remain unfinished to date. I think you had also raised it in your communication. So we shall need resources to complete. One area where I've seen a persistent complaint is Mbale, the regional referral hospital. I think there is a structure which the government started and it has stalled, and many other places. So we shall work together to see how we can get additional resources to complete these structures, but also start on new ones. Just yesterday, the Member of Parliament for Masaka was raising an issue about the Chana Mukaka Health Center 4, where she was saying they don't have a mortuary and other services. So, Engineer Dr. Otim, where is he? So your Department of Infrastructure and Construction, there is a big need out there which we must address. Number 4, government started to upgrade 34 selected health center 3s to health center 4s, and also infrastructure improvement in selected health center 3s and health center 4s. And because of limited funding, the construction in a number of areas may not be progressing to the expectation. So those resources are needed. And I just want to urge that as we prioritize health centers to upgrade and look at this infrastructure, I think the concerns and needs of the members of the Committee of Health must be considered as a priority. I'm actually saying it in a soft tone, but it's an instruction. Number 5, Establishment of health center 4s in the constituencies without health center 4s. I can also say health center 3s in the sub-counties without health center 3s. And maybe either on the floor of Parliament or in the workshop, we shall probably present the list, because we have a list of constituencies that do not have health center 4s. Then the list of sub-counties without health center 3s, but also a list of districts without a hospital. And as we design the projects which are in the pipeline, I think we have to critically look at where there are these gaps and be able to support the country, including our members, because they represent those constituencies. So we shall interact and get to know the needs in the country, including your constituencies, and to the best of our ability, resources permitting, we address all these gaps. Number 6 talks of upgrading of 5 selected facilities in the KCCA divisions to city hospitals, because when you go to Marago, Marago is also congested. I was there the other day when I visited Dr. Kiza visit, which also became a debate issue. Even when we, that I was spying, how can the Minister of Health visiting a patient be an issue? Even when we put Kawempe Hospital for women and the Chirudo Hospital for internal medicine cases, Marago is still congested. And that means we should be able to strengthen the health system in the Greater Kampala, and upgrade some of the facilities in Kampala in order to handle most of the cases in those hospitals, including Mukono. Mukono Hospital is one of the most congested from the reports I have received. So we must address the health care services in the Greater Kampala in order to have Marago handle referral cases. But you find even cases which should be handled lower level, they end up in Marago. So we have to get resources and factorize that. Number 7, and it speaks to the point I am making, establishment of a 300-bed capacity hospital in Wakiso. And the intention is to upgrade Wakiso Health Center 4 to a 300-bed general hospital, and the financial requirements are captured. Number 8, Marago National Referral Hospital requires an angio-suite equipment. Marago National Referral Hospital requires the equipment that costs 5.76 billion. I have asked my team.
The global AI market is projected to
South Africa of late to Turkey for specialized medical care. And the question has been, what is it that is in Turkey, in India, in Nairobi here, that we cannot have here in Uganda? So I have asked the team to prepare for us what exactly is needed. And we cost it. How much does it cost? Why can't patients fly from DRC, Tanzania to come to Marago? And we reverse that direction of medical tourism. And that's one ambitious target that we have set, that we improve our tertiary medical care system here in Uganda, so that we limit the referrals that go out. And I can add that part of these referrals is also a question of perception. Just perception. People think that if I go to Nairobi, I will get better care than what I get, even when what they are suffering from can be managed here. Dr. Martin will tell you they are doing open heart surgery here in Marago. The Cancer Institute will tell you they are managing the cancers. We have now sophisticated equipment like the linear accelerator. We are getting a PET scan in the Cancer Institute. All of that, the medical profession is not allowed to advertise. That's how we're told in the medical school. Ours will provide a service, we shouldn't advertise. But there is a wrong perception in the country that if you go to Marago, you can't be treated, or you cannot get cured of illnesses. They are doing a lot of wonders, but probably we are poor at communicating the good work that is done here. So some of these referrals, especially from private individuals, they just have a feeling that if I go to Nairobi, the services must be better, even when the illness they have can be competently managed within Uganda. But our desire now and our objective is to see how to make Marago Hospital and the other national referral hospitals, including those we are constructing like at Lubowa, to make them super specialized so that we reduce on people going outside to Turkey, to India, and others. Because there are situations where people have, somebody was telling me, somebody went to Marago, this was Cancer Institute, the doctor said, no, the management will be like this one. The person, because of perception, he was not comfortable. He decided to go on his own to Nairobi, only to find the same doctor in the hospital there. He said, but you are the one who was this. I handled you, and what I prescribed there is what I'm going to do the same way. So we have highly trained medical specialists. We just need to facilitate them with equipment for diagnosis, for treatment, and I'm sure we can be able to achieve that so that people don't just fly out of the country for better care. We should have better care here in Uganda. Number 9 talks about the urgent needs for the Marago Specialized Women and Neonatal Hospital, and we speak about the commodities needed and the financing gaps. I am happy to hear that the committee intends to visit these facilities, and it would be good to visit so that you see, you have a first-hand account of what goes on in our health facilities, so that when we debate in the committee, when we debate on the budget, you have a clear feeling of how the ground is. I'm now on the last page. Number 10, we are saying we need 263.4 billion for rehabilitation and expansion of Kataku General Hospital. 11, we need resources for rolling out digitization. Like I said, today, the future, or even the present, is digital. I have visited countries like South Korea, where they are using artificial intelligence to diagnose cancer, to manage cancer and other illnesses. So we have to integrate technology in the delivery of health care. We should do telemedicine. We should, for instance, connect Marago Hospital to, say, Arua, so that if you take an X-ray in Arua Hospital, the radiologist, the specialist in Marago can help you interpret, because we have super specialized doctors in Marago who can help, for instance, a doctor in Kambuga Hospital in Kanunu. That requires electronic and digital connection, which we need to do in our health facilities. Speaking as the immediate former Minister of ICT, the government is rolling out the national backbone infrastructure, the internet fiber, and they are now doing the last mile connections to connect hospitals, health centers, schools. So once that is completed, but also government has signed with an American company which uses.
Staying on top of the core concepts of sustainable investing can add value to your clients, your team, and your organization. Confidently communicate with stakeholders, build technical fluency in assessing climate-related risks and opportunities, and learn how sustainability factors affect investment performance. Start today to gain the insights and skills you need wherever you are on your sustainable investing journey. CFA Institute. Set the standard.
You've got a great idea. GoDaddy has the perfect domain name.
one issue we shall have to discuss. Like you said, Chair, when we the focus for those of us who are NRM, with the concern from the President about the drugs. Honorable members, you will go to your constituencies and the voters will complain. When we go to government hospitals, they prescribe for us drugs, we don't get them. But we have been increasing the budget for drugs. I think now we are at the tune of 1 trillion for NMS to purchase drugs. And the NMS, will speak to you later, has put in a fairly efficient system where drugs leave the stores and the vehicles are tracked along the way. They are very deliberately employed, the majority of the drivers being female, in the hope that females are more honest. more honest. And they deliver these drugs to our health facilities, and they have an arrangement that when the drugs are delivered at your health center, the hospital health center, then a communication comes to your phone as an MOP. I don't know whether you have been receiving that communication. Yeah? Because the new MPs,
I think the new MPs are not yet
they will get
hooked.
you connected. So when they deliver the drugs to a facility in your constituency, you receive a message that NMS has delivered this amount of drugs, antimalarials, antibiotics, this. The officer who has received the drugs is so and so, and his or her telephone number is this. You can call and cross-check. So I have put an investigation on my own. When the drugs reach and they are received in the store, now in the hospital there is a process how they are repositioned with the wards. But when the doctor has prescribed, eventually the drugs are taken to the wards and they are dispensed to a patient. So we are trying to find out what is the problem. Where does the leakage occur, if at all there is leakage? Is it from NMS? Is it within NMS? Is it from NMS to the health facility, or from the store to the patient in there? We shall have time to discuss this because it's a major concern. It's a major concern. Or when you speak to health workers, because I found that concern in Mbarara, I had time, and the majority of the patients I spoke to, they said they prescribe for me 4 drugs. If I get only 1, 3 I have to buy. It was a common concern. But when I went to Mbarara, because my visit was publicized, I went to Mbarara like a week later. I was the chief guest at the church. Then one woman from the congregation came after church service and said, I want to thank you, Honourable Minister. I said, why? You visited Mbarara, we saw this. And one of the issues has been drugs. But I went there recently, 2 days ago. The doctor wrote for me 4 different drugs, and all of them were given to me. And for what he attributed it to my visit. So, is there a problem within the health facilities? We shall have together to interrogate all these so that we increase the budget, but whatever increase we make, that money should translate drugs being available to the patient at the end of the day. So it's an issue which we want to work together with the committee. But I put some teams to find out and get reports where exactly. But when you speak to the managers of the hospitals and health workers, they will tell you that people usually their ears, their antennas are out. When they know that the drugs have arrived, they come and consume all of them, and by the time you bring another consignment, they would have finished. So of course population increase is also an issue. But I was asking them, now whoever comes, do you prescribe and give them a drug? It may also speak to the prescription behavior of the doctors and the health workers. There's what we call polypharmacy, where you may come, I write for you 80 drugs, but maybe 4 of them are not necessary. 3 could have. So we are looking at all this, but we are committed as a ministry to ensuring that we increase the budget for the medicines, but also medicines become available for our patients in our health facilities. So number 14, we are speaking about the community health extension workers. We have a program of training community health workers per parish who will supplement the work of VHTs so that we strengthen community health, and the funding shortfall of 11.6 billion. And the last number 15, are saying we need to mobilize up to 40 billion, procure at least 108 ambulances for constituencies that have not. The ministry has been and giving them, we give per constituency account. Of course, because of the budget inadequacies, it creates a problem. You find a district has 2 constituencies, and one has got, another has not got. And then it can also have a political implication. You may say the other MP is lobbying better than you also. Our desire would be to get resources, and we cover all the constituencies that do not have ambulances, so that we are sorted. I could go on and on and on because the health sector is huge and with many things, but we just picked some of these to stimulate the discussion. So I want to thank you, Honorable Chair and Honorable Members. And like I said from the beginning, we are here for you. We are ready to engage anytime you invite us. But maybe as we get along, I know this may not be adequate in terms of what you need to get. Madam PS, maybe we shall need to organize like even a retreat or a workshop for the committee. Because the time is limited. You may have questions on malaria. How are we handling malaria? How are we handling HIV? Cancer is a problem in the country. The ambulance referral system. We may have quick questions, but we may need like 2 or 3 days deep engagement for the honorable members to understand better and appreciate the complexity of the health sector, so that we do our work very well as ministry and the committee. But we are happy to meet you and very ready to work with you so that together we improve the health sector in this country. Thank you very much.
Thank you so much. A very big round of applause to the Minister. We shall appreciate the details of the communication that you have given to us, and importantly for ably bringing out the challenges that the sector is constrained with, but also the progress made over time. Now, what I know is that the Minister is expected to be somewhere else. I don't know how much time you want to give us before you could leave.
We have a meeting at the
State House after was supposed to be there at 12:30.
the PS is updating me that we have a meeting at the State House at 2 p.m.
Yes. So would you possibly find it to give us like 5 or 10 more minutes before you could leave? Okay, good. Yes, so we shall have the team with us, and we shall only excuse the Minister and I think the PS, but the other team members will be around. So, honorable colleagues, we want to take a few hands, but you be brief, straight to the point, such that we can have more of the members to push some few burning issues. The rest, the team will be around to respond to them. So I will take, I'll take the hand here, and then maybe I'll pick 2, and the lady first, Shiriandongo. Then I'll take the 2 arms this side before getting back here. Keep it very, very short.
Okay.
Thank you.
Thank you so much, Mr. Chairman. I would like to thank the Minister for Health for such a mouth-watering presentation. I'm not surprised you are the right candidate for that position. And no wonder, on your right side you have the PS, Honorable Diana Twine, who has been a linchpin in the health sector for almost a decade, and we are doing well. You're doing a good job, by the way, and I think you should just keep it up. God should keep you healthy so that you are able to perform and even much more. My biggest concerns are 2. Number one, since from your preamble you said we are mandated as the Ministry of Health to set up those policies and the standards that are aimed at providing high quality disease prevention and health promotion and health care. One of the key areas that probably has been ignored among the underfunded priorities is something to do with the human resource gap somewhere, and the key to note is an area of at least providing 25 to 50 billion to fund the issue of our intern doctors and SHOs. That should be included as part of the underfunded priorities. And with me here, as a reminder, which later probably we shall share, on the 9th of August 2021, we had an agreement with His Excellency, the President of Uganda, when he made out this particular write-up, and he signed it and he said the intern doctors, their pay of 750,000 is not enough. It should go to 50% of would be standard pay for a doctor, and therefore in the document it specifies 2.5 million. So it is a little bit of a hiccup that we have decelerated from the 2.5, which was paid I think for only 3 years. Then later we have dropped back to 750, and then guess what? The current policies are
yes.
exactly. Now you and I,
Yes, honorable member, I think I would call it prejudice. It's still being under consultation. So you have raised the point that they should consider the issue of interns, and which is the meeting they are going for. So and the details you
I
can
have
leave it
great
for that.
belief in those two giants.
Correct.
Honorable Minister and the PS, please stand by that team and ensure that we push for the better for the nation. Because if we actually do it the way the suggestion is, we are likely to undershoot ourselves. Thank you so much.
Thank you. Thank you. My sister.
Thank you so much, Honorable Chair. Like I said, Katsime Jovia, the woman member of Parliament, Kriandongo District. Honorable Chair, I want to raise a concern, and I want to let the members in this House know that Kriandongo General Hospital sits on the highway from Gulu to Kampala Highway. And we have always received accident victims. And the only hospital which is nearby or located on that highway is Kriandongo General Hospital. Honorable Minister, I have a concern to make, or an emergency, which I want to raise in this House. We have a mortuary in Kriandongo Hospital, which only acquires only 6 bodies, and right now the mortuary is in bad state, very, very bad state. As I speak right now, we don't have a fridge in that mortuary, and I have been receiving a lot of concern from my people of Kriandongo that the smell for the bodies is too much.
Yes, cut it short, Honorable.
So I would request the ministry to at least support us and come and fix our mortuary in this hospital. And 2, I also want to request the ministry to at least avail us with the ICU and the CT scan, since we are always being affected with the accidents on that highway. This, if you give us these equipments, it will not help only the people of Kriandongo, but all the Ugandans and tourists using that main road or the highway. Thank you.
I think, Honorable, you make an important point. Facilities that are along the highway possibly could be the facilities to have any of us at any time, so we should look at them with a very keen eye. There was another issue which came up about mortuary and something like Amolat. Yes, before I take the colleagues this side.
Thank you very much. I'm called Honorable Janet Awuma. I had the issue being situated in the fishing area. And you know, it is illegal to fish with the tools that are not necessary. So every day we are receiving like 10 to 15 bodies which has been drowned in water. So I took the initiative upon myself to build a modern mortuary, which is already in the process. So now I was saying, why don't you help us? You incorporate this hospital to become the district hospital, and also to have those modern facilities like the ICU and CT scan, because sometimes we rescue the body from the lake, but you cannot rescue this person to survive.
What is the name of the hospital? What's the name of the hospital?
It is Amolatar Health Center 4, but I would really pray you increase it to district hospital.
For the record, Honorable, did you build the mortuary on the hospital land?
Okay, I called the stakeholders meeting, and then I took the point to the council, and council approved this and gave me the hospital land, and then the process has already begun.
Thank you for supporting ministry, and possibly ministry will take it up to ensure it is equipped. We will request, I think they will send a team there, and then they will take it up from there. There are two colleagues I had picked.
Thank you, Chair, and the team from Ministry of Health. One, my issue is on the pull factor, so that our country appreciates what we give out in relation to the people who prefer going outside the country. But Honourable Minister and the team, it is also true that even internally, many people prefer going to the private hospitals or clinics than our own facilities. But I have a case in Germany where we have a department that goes out to educate the community. I'll propose that we make a package so that that package is disseminated through such departments and people get to appreciate our facilities and services. Two, on the issue of immunization of girls against cancer, I would like to really appreciate and commend our government and the ministry. You are doing a very good work. Help to give us good packages so that we sensitize our communities about the importance of this. Because we have people who still say no to immunization of their girls because they are not sure about the impact. So as leaders, if we can be brought on board and we contribute in mobilizing and sensitizing our communities, that will help us so much.
Yeah, thank you. Thank you. If you can
lastly,
yes,
I want to appreciate the Honourable Minister for the directive given, because I came here with one issue about the Madi sub-region where we don't have a single regional referral hospital. Good enough, my brother is here. I will pick your number and follow it with you. Thank you for the directive. Thank you so much.
Yeah, thank you. But we route through the minister and of course the PS,
thank you,
and not directly to the heads of departments. There is a hand I had allowed. It was yes. After you, I'll take Honorable Nampose and the Honorable Sarah. Yes, but make it brief. Then I'll come to Kampala and here before we let the minister respond.
Thank you, Honorable Chair. For the record, my name is Halai Peace. I'm the woman member of Parliament for Namisinda District. Being a member of the Health Committee, Namisinda on record is the only district without a health center in the whole country. We were in Munyonyo, and that is what they displayed for us, that only Namisindwa is the only one without a health center And today we have the PS, the Honorable Minister, the engineer, and my biggest prayer to this committee and our technical staff is that we prioritize districts that do not have health center We are suffering, our people are dying, our people are traveling to Kenya to give birth. People get accidents on the highway of the Ruahaha, Kenya road. So my prayer is that the health team today prioritizes Namisinda district as one of the first districts to be upgraded. And we have health center 4s, health center 3s that can be upgraded to health center 4s.
Thank you.
That is Bumbo Health Center 3, Bubutu Health Center 3, Bupoto Health Center 3. And another thing,
cut it short.
Ruahaha Town Council is sorry?
Have you as the leaders agreed on which health centers?
The Bumbo Health Center 3 is ready for upgrade. And Ruahaha Town Council is a border town council. But one question that I had to the committee is, if a health center 2 is coded, but it does not have land for expansion, can it be expanded in another area? If land has been secured in another place within the town council, can the health center 3 be constructed or developed in another place, not in the area where the health center 2 is? Thank you so much.
Yeah, thank you. I have given the opportunity to Honorable Nambose, but colleagues, let's try to summarize. You can make your points without necessarily giving much elaboration, such that we pick as many as possible.
Thank you, Mr. Chairman. Mr. Chairman, in Mukono, I have a hospital just in the name. But physically, if your committee would visit, you would establish that we don't have a hospital in Mukono. Because, Mr. Chairman, just the basic that makes a hospital, at least, what maybe the minister would tell us, basically, what should be on ground to say that this is a hospital? Because you can give us a hospital by title, but when physically you have a facility that does not have just mere wards where you can admit patients. I have one ward to admit men, women, people of all ages, diseases, everything in one ward. 2, no x-ray, nothing on the ground, Mr. Chairman. So I want to know basically what must be on ground for a facility to be called a hospital. And then 2, even that small facility we have, then it is divided into private and public, facilities. And even the little we have now has been set aside for people who can afford it to pay. And I don't know the policy. What is the policy in determining that at such and such a place, we can establish a private facility and then also have a public facility in one place? 2, Mr. Chairman, the mortuary itself, there is a room that was supposed to be a mortuary, but it has no refrigerators, so it's just a dumping place for bodies, and they start loading the very minute you.
I own these shops myself.
But the way the whole project was hatched, what has remained after the first cleaning is that the cities are more dirty. This time the rubbish is just at the front. That was behind was brought at the front. And our streets now are lined with garbage. And there was an idea that this thing be called off and we organize it better. And we launch it when it is, properly organized, and it becomes more of a healthy project than that we hear more from health workers than from policemen. Because what is happening now is that the whole thing is being coordinated by the police. You hear the police saying, we are ready to arrest, we are ready to do this, and none of us was involved. Yet we, in essence, would support the project. And then,
in summary,
in 20, the Auditor General reported that 27 districts received the 1,761,507 doses of vaccines but they did not have adequate facilities for storage. And then he reported that the vaccines were damaged. I want to know what became of this, and in those districts, did they use the vaccines when the Auditor General is reporting that there were no proper facilities and the vaccine was damaged? Did they go ahead to use them on our people? And lastly, it's about Dr. Kizza Besigye. The family of Dr. Kizza Besigye has continued to complain against you, Mr. Minister, that you are imposing yourself on their patient, even when Dr.
Yes,
Kizza Besigye is sick.
Honorable member, thank you so much.
Mr. Chairman, you allow me to raise this. It is very important.
The minister had hinted about it. Maybe you were out, but the minister had hinted about it. But you can summarize it, please.
Mr. Chairman, Dr. Kizza Besigye's family, especially the next of kin, Engineer Winnie Byanyima, has said that Mr. Balyomus, Honorable Balyomus, is imposing himself on the patient. And when he visited him, the patient was grabbed out of Mulago. And as we talk right now, they cannot trace where their person is. Which type of doctor would treat a patient so, in such a cruel manner, really, doctor? This is a person who comes.
You have made the point, Honorable. You have made the point.
Why are you harassing Besigye?
It's noted. You have made the point. The minister has taken note and he will respond. Honorable members, the minister will be leaving shortly, but want to request that the next colleagues, you make it short. 1 minute and I'll time. 1 minute each. Over to you. I'm turning.
Thank you, Mr. Chairperson.
I'm coming over to you.
Thank you, Mr. Chairman. My name is Sarah Kabarokole, Woman Member of Parliament, Bunyangabo District. Very first, I'd like to thank our Honorable Minister, one, for responding to many of our questions. We've always reached him and we really answered. Two, I'd like to thank the Minister of Health for having really come around to answer some of these questions. And specifically, me in Bunyanga would like to thank you. I think 3 days ago, 2-3 days ago, there's a team from Ministry of Health that has come in my district to settle and find out some issues related to cancer. And even right now, the team is already there. Also, the team from Cancer Institute is also there, because cancer has really, I don't know, people are dying of cancer every day. And dear doctors, please look into this. Cancer is everywhere. And I thought our people in Bunyangabo are the ones dying on a daily, but I realized it's everywhere. So let's look into this. Let's not only look at different diseases, measles and maybe communicable and non-communicable, but also these other diseases. But the point is, in my district, specifically Bunyangabo, we have only a health center for, but we also need a district hospital. Two, we don't have a mortuary. People die and they just cover them there while these other sick patients are seeing them. So it tortures them so much. So we need a mortuary. Then lastly, is there any plan of maybe constructing a regional cancer institute, maybe Western Uganda?
Thank you.
Thank you so much.
Note. Thank you, Honorable.
Maybe lastly, I'd like to thank my commissioner.
Time, Honorable, time.
Only 1 minute.
Many colleagues want to speak.
Okay, 1 minute. To thank my commissioner, Dr. Mugahi is right here. I've seen him around. And Dr. Mugahi, he's really responded to some of our problems in the Bunyangabo district. Thank you so much.
Dr. Mugahi, could you stand up? That is the Dr. Mugahi they are talking about. Thank you so much, and the Minister and PS, thank you so much.
The Commissioner for Productive Health.
Yes. We are proud of him and for his dedication. Over to you.
Thank you, Chairperson. I know the father of the ministry is here, who is our Minister for Health. Just want to have three things. One, the universal health coverage of Uganda says that by 2030, we need to have covered people with health services to 65%. As the father of the ministry, would wish us a committee to understand how near are we to 65% in terms of universal health coverage. Number two is on HIV. We have the 95-95-95 strategy. We know that we have achieved the first 95 and the third 95, but the second 95 of having all clients diagnosed with HIV, having ARVs, we are still struggling as a country. We have what we call the HIV/AIDS Trust Fund that was passed some time in Parliament, and we have not operationalized it up to now. I want to understand from the ministry whether we have the alternative resource mobilization strategies in case this HIV/AIDS Trust Fund is not operationalized. Do we have any domestic source of revenue or money to ensure that we have supplies for HIV? The last one is that Karamoja has 9 districts and Tier 3 geographies. We have North Karamoja with 4 hospitals. 4 districts actually, and 3 hospitals. And then Central Karamoja, where Moroto Regional Referral Hospital sits in. And that's Moroto and Napak district. They all have regional referral, which support the whole region. But South Karamoja has 3 districts. That's Nakapiliprit, Amdat, and Nabilatuk district. And quite far from the central region. They have no hospital completely. But we have one health center for that has been there since independence as Health Center 4, called Tokora Health Center 4. And it has good infrastructure. I think it just needs a small push to hospital status.
Thank
so
you.
I request
Thank
that as the minister is here and the PS here, I know PS must have
they have taken note, summarize.
Have that Health Center 4 go to hospital status. Thank you so much.
Good. At least you have mentioned the number of points, but in a summary form. How I wish the colleagues, you just speak to the point and we move on. My friend, then we move to this side and we close.
I'm not it. I speak.
Thank you, Chair, and the team from Ministry of West. As my colleague said, we have a challenge in Manafa because most of the patients live in Msindwa to be referred to Manafa. So I pray that Gobelo Health Center 4 to be upgraded to the hospital. I submit.
Thank you. Yeah, thank you. Thank you for that high-level summary. I turn over this side.
Thank you. Thank you, Chair, and thank you, Minister. I don't want to devolve so much. I think we discussed in the caucus about the Buku Hospital and Kapchoro Hospital. I'm sure you are following it up with the PS, and I think it will be worked on. Minister, there is one thing, is the issue of charging money in hospitals. I want to refer, let's say, to Heart Institute. You find that a condition, they're working on a patient and they have to pay colossal sums of money. And this is a government hospital. I will still think we need to be fair to Ugandans. Well, a patient is charged 60 million, and most of these people are from very poor. I have Akela, one of my neighbors, who Akela, we have been doing fundraisings for almost 6 months to raise 60 million. And then when you go to Mulago, CT scan, and most of the services you pay. Yes. So really, I lost my mother early this year. And she was admitted in Mulago Hospital, private wing. First, we were admitted in Platinum. The money we paid in Platinum for the number of days, Mulago, we paid more money. And then but we thought Mulago should have been fair. So, Honorable Minister, there's need for intervention on that area. Thank you very much.
The point is made, my sister.
Yes, thank you very much, Chair. Thank you very much, Chair and Honorable Minister. I just want to say that, Honorable Minister, when you look at the role of members of Parliament and other politicians, we have a great role of joining hands with the health team to create sensitization for mindset change. Because we have all the avenues, we attend burials, we attend meetings, at least we are there with the people. My humble appeal is if we can have a simplified fact sheet given for the members of parliament, so that wherever you go, you are able to create a kind of sensitization in the community. Yesterday we attended a meeting of measles rubella campaign, which is upcoming, and they told us that the ward in Mulago for measles has been opened, because meaning there's already children are dying of measles. So those are some of the things we are urging the government to help us and us MPs, so that we join hands in creating sensitization. Districts that are along the Nile, like Obongi, we are having rampant cases of hepatitis B. Monthly people are dying, daily people are dying, and even cancer is on the increase. So we request you to help us and join hands in creating sensitization on some of these non-communicable diseases and some of the common diseases that are trying to attack the population.
Beautiful. Thank you.
Another thing is,
Summarize.
Minister, I'll request that in terms of equipping the district, the health facility and the district hospital, try to give priority to districts that are hosting refugees, because the demand is so huge that they are competing with the resources, the hosts and the refugees. Like, for example, Obongi. The health center 4 we are having currently is also part of the health center has been affected by the road that is being constructed. They are using even pediatric beds for now, the adults. So the whole situation is very miserable.
It's noted, Honorable.
Lastly, I'll request that probably to understand their need of the health situation in the districts, probably let's have a team going down to the district to assess the needs of the various facilities that are having, so that we respond to the needs directly. Thank you.
I think, Honorable Minister and the team from the ministry, you can see the ideas coming from the members of parliament, the more need for continuous engagement, such that we can be adequately and timely responding to this. Honorable Zake, make it short.
Thank you, Chair. The Honourable Minister, I've seen in your report here, in your statement, you have indicated the challenges that is facing this sector of health. You've indicated about the 6 challenges. In my opinion, I would think that the biggest challenge of this sector, the number 1 challenge, would be corruption, which has not been indicated. Corruption in the sector. It has eaten up this sector so much. As a fresh minister, I would expect you to have handled this to be one of the challenges, the main challenges of this sector. Because we have seen almost the whole country, when you check out in terms of their stores in drugs, they are all stolen out. Patients don't get the drugs they need. And when you find in the private drug shops, the medicines are there in the drug shops. And then there is also a problem of the cross-border smuggling using cartels. These drugs go to Rwanda, Kenya, Tanzania. They are found right there. So as a minister, I expect you to carry out oversight to tame corruption, even from top, from these officials in your teams. Man is swindled. Please do a lot of check via that, so that this sector can be organized. It's one of the rotten sectors in this country, Uganda, that you need to put it to order. A lot is not well, as you will come up with a report as if it is just, funding that you require, but even the little you get is not put to use. That needs to be investigated and put to order, so that our people do not continue to die because of lack of medicines, because of lack of equipment in hospitals. When you check out my own hospital in Mityana, the Mityana General Hospital, oh my God, from cameras to computers to everything is stolen. And this is across the country. Please be serious in this sector so that you handle the problem of corruption.
We take note. We take note. The point is about corruption. And you know, the president emphasized that this is Chisanja, no more sleep. Chisanja, no corruption. So that is the point the Honorable is raising. And again, for the record, the Honorable Minister, Dr. Chris Bariomusi, is not a fresh minister, but he's a senior minister. He has been in the government for quite some time. And also to the ministry, I think he had a tour of duty in the ministry, and he's coming back. But your points are very, very well noted and very valid. Over to you, Honorable.
Thank you, Honorable Chair and the members of the committee. I would like to draw attention of the ministry of the situation of the communities in Kotido. First of all, I would like to thank you. It's always good to be grateful for the little that somebody has done. Even the Almighty, many people complain, but He does not answer everybody's question. I would like to thank you that you upgraded Kotido district as a general hospital, and also we have a challenge. We have so far around 6 sub-counties that do not have a facility, health facility. And this is a national objective of our government that requires that to put a practical measure to establish facilities for our people, health facilities. My request is that our constituencies, it is not about only Kotido, it's about all the districts in Kotido district. Ugandans, regardless of anything, needs facility, health facility. So we need really to support our people with the health facilities. Kachari sub-county does not have any facility. You go to Loletio, does not have a health facility. You go to West Division, doesn't have any facility. But it's not about the distance, but it's about the numbers of people, the areas that are populated. So we need to really look at that and support our people.
Thank you.
Other than upgrading very many hospitals, but we need to push facilities to people that do not have any facility.
Thank you. Thank you.
So that our areas, our people are supported.
Thank you, Honorable. Honorable over there, we are about to finish.
Yeah, thank you. I want to appreciate the Minister for the report. I just have 2 things to highlight. You mentioned Mbale. We have a regional referral that has a surgical complex that has taken almost 10 years not completed, and yet the regional referral currently, I think, has only 1 theater. It's my prayer that the ministry prioritizes the regional referral to complete the surgical complex to help the influx of the patients in the region. Secondly, I want to talk about the cancer problem in our community. I know there has been funding or a need to have the regional cancer treatment centers. I want to pray that you give us a report. How is it? I know in Bali there is one, but still people come to Mulago for the treatment. And I also want to hear about the PET scan. As a committee, it was funded, but I do not know whether we have that PET scan in our country. Honorable Minister, you talked about tourism, medical tourism. Most people are moving out of the country just because there are no equipment to help them. Apparently, I have lost a cousin because of cancer, but we had to move left, right, and center to see that we save his life, but we couldn't. So kindly give us a highlight on the PET scan. Do we have it? Is there funding? Is there no funding for it? why are people moving out of the country for treatment that can be ably got in our own country?
Thank you. So, let's take Kampala. Kawempe.
Thank you very much, Chairperson, Honorable Chairperson, Honorable members and colleagues. Hajat Madina Serko is my name, and I'm the area MP for Kawempe South, where you find Mulago Hospital, the Cancer Institute, the Heart Institute, name it. My concern, let me just go on point because of the time. My biggest problem with the Mulago National Referral Hospital, we all know that it has two, I would call it apartments, not apartments. It has two sections. That is the private and the free one,
and the public.
And the public. But maybe I don't understand the meaning of public, because there is nothing that is free. And my biggest concern goes to the X-ray department. Even if you have got an accident, you cannot access an X-ray at a free cost. The CT scan in the National Referral Hospital and the public sector, you cannot. Please, kindly, this day morning, someone called me. My child is dying. He's vomiting, has anemia, but I've been told to pay 170,000. Can you please contribute for me at least something so that this boy can be operated on? Please, kindly. And another thing that I want you to investigate, I don't know if it is supposed to be like that, the fee that is paid in an ICU, that 1 million every week. Why do they have to pay 1 million in a public national hospital?
Noted.
Me, I get a problem because they know I stay near and they call every night, accident and so on.
It's noted, Honorable Member. Thank you. And also next week, the team from Lago will be with us. Please, again, attend and let's have them respond adequately in addition to the response that we shall receive. Honorable Namboze, what is it that is aching? 1 second, less than a second.
Mr. Chairman, thank you. I recently lost my father, but I was told during his days in hospital that Uganda has a policy on admission of all the people in ICU. I want to know from the minister if it is true that all the men and women are not prioritized when it comes to admission in ICU, and then the 150 billion equipments that we bought for ICU that now are reported to be lying idle in hospitals. And then, Mr. Chairman, lastly, there is inspections now going on around the country and sacking, interdiction of medical workers by the brother Minister of Local Government. So I wanted to know what the ministry thinks about these inspections that, as the Ministry of Local Government taken over now, even the Minister of Health. And what do you think about the arbitrary holding, detention, and interdiction of health workers, plus the new policy on abolishment of the nursing aides that has increased the workload on our nurses? Thank you.
Yeah, thank you, Honorable Namboze. Those were very valid. You know, I had expected you to have reasoned them the other time we gave the opportunity. But thank you, they are well noted. Vice Chair, in summary.
Thank you, Honorable Chair. I want to appreciate Honorable Minister for the statement he has made to us, but also emphasize some of the issues, Honorable Minister, of course, with issues that are hurting the communities. Honorable Minister, you talked of getting a system, an information system that connects the National Referral Hospital like Mulago with the regional referral hospitals, and you talked about X-ray reports. There is as an example, yes, and you were very much spot on for me, and I believe it doesn't only apply to Mubende Regional Referral Hospital, but to most of the health facilities in the country. There is a time in December when I had one of my boys at home get involved in an accident, and his limbs, both the legs and the arms, were fractured. And we did an X-ray in Mubende Regional Referral Hospital. He was referred to Mulago. When he reached in Mulago, they requested for another X-ray report. Yet he still had the X-ray report that was done in Mubende. And actually, in either hospitals, it was at a cost. So we should look at the system as urgently as possible to help minimize the out-of-pocket expenditure, like we've said. At times we know it is even not necessary for them to charge, but they end up doing. And because one is badly in need, in a dire situation, they pay. But also, the burden comes when they have to pay twice. Honorable Minister, that should be taken very good note of, not only for Mubende Regional Referral Hospital, but for the other facilities. The other issue that I would like us as committee and ministry, because we are part of you, Honorable Minister, I appreciate this, and all we do should be aiming at improving health service provision in the whole country. The issue of health services being functionalized, Honorable Minister, is very, very critical to the health sector of Uganda. Honorable Minister, we have had a health facility being upgraded from Health Center 3 to a 4 for quite some time, yet the project time was very much exhausted. So it is my prayer that you follow up on those projects that are still pending beyond their project times to ensure that the Ugandans benefit from the money that government has put aside to do some of these activities. Honorable Chair, I still have some issues to raise.
Summarize, please.
Honorable Minister, you talked about structures that are stalling. It is very unfortunate to see a structure, for example, on a regional referral hospital or on a general hospital, that is at a level of 80% or 90% stalling for over 5 years. This is money that government prioritized in order to ensure improvement of service provision. For example, we have Mubende Regional Referral Hospital. We have a facility that is made for maternal and child health. It is at 99% completion. That remaining percentage should be prioritized for us to ensure that we provide services. I'm speaking about that because I particularly know that, but there are a number of structures all over the country that are just requiring a little money to have the structures useful to the Ugandans. Honorable Chair is limiting, but I cannot leave this unsaid. The issue of electricity to health facilities, Honorable Minister, let us work with the Ministry of Energy to ensure that there is efficient energy provision to the health facilities. In Mubende Regional Referral Hospitals, we've suffered very big losses of instruments just because of electricity provisions that are not sufficient to support the health facility equipment. I am speaking about Mubende, but the other time we met with directors of regional referral hospitals, and their bills of utilities were very high. Besides that, they also had complaints of a very long downtime of equipment just because of electricity surges and ups and downs. Another thing that I would like to overemphasize is health promotion. Dr. Chavains is here. It is under public health, I believe. Let's do something to ensure that Ugandans get to know what they need to do in order to benefit from the little resources we have, at least efficiently. Because you find so many people going to health facilities, consuming the drugs over something that would control by just a mere talk show. I remember, Honorable Chavains, there are times when you go to radios, and in most cases it is when we have outbreaks like Ebola, but let's make this routine.
Thank you.
I thank you. I'm very passionate about diagnosis. Let's have electricity issues sorted in health facilities. Thank you.
Correct. And for the record, she represents Mubende district as woman member of parliament. So when she speaks about Mubende Regional Referral Hospital, she's very passionate. And I think the voters have heard because we are live on UBC. Yeah, we want to surely thank the ministry, Honorable Minister of Health. I think you deserve another round of applause. Together with your team, thank you for coming to the committee and listening to us and giving us all this time to listen to the concerns. Some you will respond to them, some the colleagues will, and some you could even respond in writing, and then it helps us. But allow me point out that we want to thank Minister of Health. I one time attended the review meeting, yes, Dr. Diana had invited me to attend the review meeting. I was particularly impressed by the public feedback mechanism of the QR code that the minister has introduced. This has capacity to improve the quality of care. Continue like that, but make sure it trickles down to the grassroots, up to the lowest level of the health facility. Like the members have said, users, we are here and we can amplify some of the health messages, especially to our populations. Want to request you to give us a copy of the new staffing structure. You give us a copy, you give us the committee a copy of the new staffing structure. Also would appreciate if you could allude to some dates you think we can have the orientation for the parliamentarians, and then we plan accordingly. If we can structure it, you give us the dates. When you think we can have this, and then we can process it as an activity, of course, through the Speaker of Parliament, and then we can work hand in hand with your team to have this ready. Honorable Minister, I want to emphasize that the issue of interns should not be underrated. It should not be underrated. I know you are handling it with care, but don't underrate it. Handle it to its logical satisfaction. The issue of the new designs, infrastructure, with the current growing population, I'm very particularly happy with the maternity structures that you colleagues are putting up. And I think if we can move like that, even with the wards and the others, thinking through the future and the growing population is very, very important. Maybe if you can let us know about that. Have you thought of decongesting Kampala for the national referral facilities, and think of maybe having national referral facilities in regions? Say in Western you have one, in maybe another region you have another one, where some of these referral facilities are actually, decentralized to some regions. And also, have you thought of maybe coming up with additional regional referral hospitals? Because there are some regions actually that possibly don't have regional referral facilities, and all these have capacity to decongest the city and the other regions that are actually having high volumes of patients. I thank you. I want to give the floor to you to respond to some, and some you want to respond to, the colleagues can support you. Even some you can give us a response in writing if you are unable to give us the feedback right now. Over to you, Honorable Minister.
So thank you very much, Chair, and the honorable members, for the questions, comments, points of clarifications which you have raised, and we have captured everything. So even if we don't adequately give a response now, but we have taken note, like the request to upgrade health centers, maybe need for mortuary, those infrastructure-related issues, we have captured them. So even if we don't give a definitive answer, but my team has been capturing. So I will respond to some few, and I hope the PS, the DG, and my team from the ministry were taking a note. So when I finish, I will give PS and Director General to pick areas where you need to comment. Like when the Honorable Nambo asked what makes a facility a hospital, DG and the PS, you should respond to that. But I appreciate you for the constructive ideas which you are giving us, like saying we should produce a pamphlet with the simplified information which we can share with the members of Parliament so that you sensitize and educate the public. Issues of malaria, issues of family planning, issues of these communicable diseases, immunization. I think we welcome those ideas and we shall definitely take them on. I don't know whether we can give a definitive date when we can have the retreat. We shall have to liaise with the clerk and look at your time, the convenient time, and from the ministry side, and then we communicate. Maybe now we may not point to a date, but I think it should be soon, maybe by the end of August, early September, in between there. Because in this meeting, we can't adequately raise the issues and also answer to them, but in a workshop retreat fashion, we're able to interact much deeper, even get to know each other much more deeply. So some of the concerns, the National Cleaning Days. Let me start with the Honorable Namboze. Well, this is an issue which was raised in the Cabinet, and a decision was taken that we declare the last Saturday in a month a National Cleaning Day. True, I accept the launch, probably was hastily done, but it was by and large successful because Ugandans responded. Well, we said the last Saturday from 7 to 10, people in Uganda, even the foreigners, dedicate that period to clean the neighborhoods with the rest of the community. Now, learning from the lessons of the last event which we had, we shall now improve the one for August, this August. And actually, even yesterday, there was a meeting chaired by the Prime Minister to get the lessons from the last event so that we can improve the way it is done. And like we said, it's a national cleaning day, but that doesn't mean Ugandans should just sleep and stop cleaning on the rest of the days. So we shall have to do a lot of communication. I agree with you, the security and police should not be the one in the forefront, but rather we should sensitize Ugandans to appreciate the need for cleanliness, and the policing should be done by an individual to know that, oh, I need a clean environment, a clean home, rather than the police enforcing and so forth and so forth. So all those gaps will be addressed so that we sensitize Uganda. But we appreciate the comments from members and the public. I think we are supposed to give a statement as a government on the floor of Parliament on National Cleaning Days, where we shall further discuss that. But we are saying you postpone this. We have already launched. Now we cannot reverse what happened. What is important is to now organize better for the future cleaning days. Charge? Yes.
What charge does it have on, what is the financial implication? Does
He is the accounting officer. He
on the
takes notes
ministry?
and answer it when it comes to that. Now, you raise the issue of the inspection is being done by the ministers of local government. Are they in contradiction with what we do. Like Honorable Zaki said, corruption is a very big issue in this country, and you heard the President loud and clear that this Sanja is Sanja no more sleep, Sanja no corruption, Sanja no more politeness. So the inspections are okay, particularly where the ministers have information and evidence that there is criminality and wrongdoing, and they do it in accordance with the law. There is nobody above the law, whether you are a health worker or not. In some of the areas where they have been, they have moved with our Minister of State, the Honorable Anifa Kawaya, like when they were in the Greater Masaka area. So there is no big contradiction as such. And they are moving in the local governments. And part of our system, health system, is under local governments, like the district hospitals, what we sometimes call general hospitals, because in many cases they serve more than one district. Then the health center 4s, health center 3s, yes, under decentralization, they fall under Ministry of Local Government, although technically they fall under the Ministry of Health. So we have not found a big problem with the work that they are doing, but definitely we coordinate with them so that we harmonize these inspections and supervisions that we do. Now, the issue of visiting Dr. Besigye is just politics. I don't want to drag the committee into that, but are you saying there is anything irregular, a Minister of Health visiting a patient? Because in the health facility like Marago, because my understanding of my role is that I am supposed to ensure that all Ugandans have good health, whether you are NRM supporter or opposition. I am a minister for all Ugandans, irrespective of our political beliefs. And even if Honorable Winnie Byanyima herself is sick and hospitalized, I will visit her and ensure that she gets the best treatment. So it is in that spirit that I visited Dr. KB. Only that by coincidence, the doctors who were treating him discharged him on that day, but my visit had nothing. And I was taken aback when I was seeing insinuations that I went to Marago to direct them to, they are not even saying discharge, but to chase him from Marago. The medical profession I had to work like that one. Even if I was to direct them, I don't have to physically go there, I would have called from the office. But first of all, chase him for what? Dr. Besigye is a Ugandan. I think the problem, like I've been saying in the media, is the toxic political environment we have caused. For people to think that because I am a minister and NRM, I should not talk with the Honorable Namboze. Outside politics, I can come to your home if you invite me for a party and I attend. Yes, invite me and I will come. I will come.
Yeah, that's good.
I gave a... Yes.
We went to see that. And so many things came up after what this.
No, I was in okay. It was national guidance.
And he was dropped out of the hospital.
Oh, thank you.
There are things, you see, you have to study some of. Let me give you an example. I have given it in the.
Yeah, Honorable Namboze, speak through the chair, not directly.
We must do politics of tolerance and accommodating each other. Let me give you an example. We sat in the house here, paying tribute to the late Sejirinya Honorable. I undertook to pay for one of his children, and I'm paying fees for his child as a Dr. Principal Yunus. Now, when I was going to bury him, send him off in Masaka, I was told the foot soldiers of opposition are going to lynch you at the burial. No, is that the politics we want? So Honorable Namboze, I'm saying, we should play above pettiness in our politics in Uganda, so that even when we have different political persuasions, there are things which unite us as Ugandans. This adversarial, toxic politics, I don't think will take us forward as a country. So I am of the caliber that I can be NRM but still be your friend. When I visited Mulago, I found Dr. Olive Kopsinja, who is a biological sister to Dr. Besije. She was extremely very happy that I went. I talked to Besije. He was very happy because I talked to him. He was gesturing. When I said, I wish you quick recovery, he smiled and said, I wish you quick recovery. He smiled and said, yes, yes. So, when Bianyima has her own politics, she tweets from Geneva when she's not even physically here. So, but that's aside the point. But there is nothing that will stop me as the Minister of Health from visiting. Yes. So,
Honorable Namboze, I think the gesture was that the colleague had visited.
Visited, yes.
And
in
also
in a good faith.
In good faith.
In good faith.
Thank
so,
you. Proceed.
In a good faith. So, please accept it that way that there were no ill intentions at all. The Honorable Sister of mine, Sarah Kabarokole, yes, we shall respond to all issues that members of Parliament raise and the public. Like that visit by the team from Cancer Institute to Binyangabo was as a result of a question which was raised on the floor for us to respond to why they are increasing cases and associated deaths from cancer in Binyangabo. So, and the team will bring us a report which we shall bring to Parliament. Now, as a new minister, I also still have questions for the Minister of Health, so you are putting them to me. Like the question of charges in Morago and the hospitals. I don't know whether the PS and DG can give an answer. I also have questions for Morago actually when they come. Because in the hospitals, from a district hospital, which is sometimes called a general hospital, upwards, the policy allows for grade A, grade B services, where you have services that are public and then private wing, where if, for instance, me who can afford goes to Masaka Regional Referral Hospital and I don't want to line up with the rest of the public, I can go to the private wing, pay, and then I am handled.
She is kind of a big deal. And no,
download the MTN TV by Afro
that so that somebody who is an indigent, a poor person, should be able to get a service when he goes to Marago. The same thing I have asked my brother, Dr. EM Cancer Institute. Somebody comes from Kanungu, is poor, cannot raise. So why should that person be chased from Marago or from Barara or from Uguru Hospital? So, but I want the team which has been in the ministry to answer to it. But it's one concern that I have as a new minister, which we have to streamline, that the services should be affordable and accessible by the people of Uganda, the public side in the hospital. But the baby Diana and the Professor R, you could. Then finally, for my part, Honorable Zake, I think I will interact with you. You are a whistleblower. You give me additional information because we don't tolerate corruption, like we have said. I may not have overemphasized it. People have even asked me, when you visit the hospital, why are you not arresting people like the other ministers? I said, well, if there is need to arrest, we can arrest, definitely. But for me, my approach has been, I go to a facility to familiarize myself with how the facility runs, like when I go deep in the night. We don't want health workers to abandon the Ugandans because it is at night, because the diseases don't have a calendar. And I appreciate the good things being done. I take note of the gaps, the challenges they are facing, with a view of having them fixed. And from my observation, some of the challenges require the center to fix. Others are managerial, where you need to take some administrative action. Where there is criminality, definitely, and it's obvious, we can arrest. But for me, I don't necessarily use the cameras to do that. But there are actions we have taken in some of the places where I have been. But if you can give me information regarding even these people who are here, and there is concrete information, we can definitely take action. So corruption is one of the areas. Yes? Please. So I am going to engage with you. You give me information because you have made very strong allegations that even the little money that we get as a ministry, it is shared and eaten. If I can get the concrete evidence, very definitely we take action as the ministry, as the government, because whatever little coin we allocate the health sector must go to the Ugandan down there who need the service. And this again is a strong message to the team from the Ministry of Health that we must promote a zero tolerance policy in the ministry. So if I can get that information, which we may not be able to give on microphone, we definitely have to take action. But it may also not be good to just make wild allegations when you don't have evidence. So it takes evidence and information for you to criminalize somebody. So I'm usually very careful not just merely allege unless there is proof. So if there is information, give it to us, and then you will see action taking place. In the interest of time, let me ask PS and the DG and Cancer Institute. There are questions about the regional cancer centers and the cancer and so on.
Yeah, maybe before the PS could take on the rest. Thank you so much, Honorable Minister. We appreciate. Honorable colleagues and the technical team, there is tea over there, just in case you can just walk back. And serve yourself.
Again, to talk about General Hospital, because when you look at the structure of the health center for the current structure, it is like of a General Hospital. The staff, the PHC, the medicines, everything is like for a General Hospital. So right now, what the Ministry of Health is saying is that we no longer talk about General Hospital. We talk about community hospitals. So all constituencies that don't have health center force, that is our target, and we have already put in our request in finance to make sure that all, including Namisindwa, you are on our list and you are priority, and we are going to make sure that even the existing health center force that don't have infrastructure that really meet the hospital status, in the next loan we are getting, our target is to make sure we put more staff houses, the wards, the expand theater capacity, increase the store and all the amenities, including the mortuaries. So that's what we are going to do as soon as we get the resources. All the constituencies that don't have health center force are going to have, and also those health center force that do not have infrastructure that suit the definition of a hospital. That's what we are going to do. So we'll no longer talk about General Hospital, and so that I thought I would talk about that. On the issue of Chiriandongo, we know that it is on a highway, and it lacks quite a number of equipment, including the CT scan. But we wanted to first prioritize the regional referral hospitals to put a CT scan. We still have some regional referral hospitals like Kayunga, like Naguru. They don't have CT scan. We didn't have enough money, so we couldn't go to the general hospitals to equip them with those scans. Also, that equipment requires additional human resource. You need a radiologist. It took us a while to recruit even radiologists in all the regional referral hospitals. Even some of the CT scan that we put in the regional referral,
they were sending reports to the center for interpretation and then sending back. So, but we shall go systematically. Once we equip all the regional referral hospitals, then we come down to those special highway. Chiriandonga is one of them. Chibok is one of them. Nebi and Moyo is one of those big hospitals that will want to make sure that we equip them as well. So we've not forgotten, including also ICU. The ICUs, and I will combine with her question, which was talking about equipment that is lying idle. I think it is not true. Over time, we've been functionalizing this. When we bought those equipment, it was in the middle of the crisis. We didn't have infrastructure. We just bought. In the corridor and save a life of COVID because they needed those ICU. But over time, when we got resources, we expanded, we have built over time. The ICUs in a number of regional referral hospitals are fully functional. The ICUs are functional. But we don't want to stop at regional referral. We want also to come down to those big general hospitals and we equip them with ICU equipment. What we are lacking right now, and what is Honorable Minister talked about, is to have the human resource. Because it is pointless to have an equipment and you don't have the staff to run it. That is a negative expenditure, and the equipment, once you don't use it, it gets spoiled, and that is really wastage of resources. Remember, we don't have enough resources to handle all our needs. So we go systematically as the need, as we go along, as we get the resources. On the vaccination, no, I wanted also to correct the picture that the private are getting more patients than the public. It is actually not true. Before it was 55, 45, but right now in public the number is up to 68%. The numbers actually, the PNFPs, even the bishop, some bishops have written to us that some of the hospitals, the wards are closing because they don't have patients. Recently I was in Hoima, I visited the mission facilities, and the wards are all empty, completely empty, and all the patients are coming to the public. That's why we have even flow patients. People are trusting our system now more than before. And that one, we have the statistics, we have evidence that people are trusting our facilities more than, even when you come now to Chirudu and you see the numbers, you go to Kawempe, the numbers we have in tens of thousands, it is because people are trusting, and yet we have many private facilities around. But the numbers that are coming to our facilities is because people have more trust in our facilities.
Yeah,
on the waste management,
PS, I think you're very right on that point, and it should be on record that actually government facilities are now performing much better than the other facilities. The case in question in Kasese, Nyavirongo, is now conducting about 400 deliveries a month, compared to Kagando, which is a PNFP that is conducting less than 50 deliveries a month, including the C-sections procedure.
We have all the evidence. Even when you go to all these, even when you go to the districts, interest yourself in getting the numbers that people who come to the private and also who come. You'll be amazed. It is more than double. It is not true that 27 districts, their vaccines got spoiled. I got it from here, and that is alarming. I am not aware. As far as the Ministry of Health is concerned,
can I give you information?
Let the PS first proceed, and it's noted. Should you have additional information, it can be given later. Let the minister.
And because of the interest, because at least National Medical Stores delivers the vaccines up to the last mile, and also is in charge of the cold chain equipment repair, and they have all the record. They repair the equipment in real time, And so 27 districts, that is absolutely strange. We give fridges, we give up to health center tours. The health center tours, unless those health center tours are just built recently, which is not true because we are phasing out health center tours. And also all the vaccine, even in the private not-for-profit, we give them fridges to immunize the children, and we give them also free vaccines. So I would really, I want specifically, I'm going to take up this particular issue, because if you are saying that vaccines were spoiled, how much vaccines were spoiled, where, which districts, and what are the reasons? I am very interested. Honorable Namboze, I would really welcome that information in detail, because this is absolutely very strange to all of us here. We got a shock to hear that. On the HIV...
You just go and read the Auditor General's report at page 64. It is clear 27 districts that received 1,761,507 doses of vaccine, costed at 16.62 billion, lacked the adequate, appropriate storage facilities.
Which vaccine?
Maybe
he is talking about COVID, because at one time, COVID, people rejected the vaccine. When the epidemic stopped, people, they were not very keen, and yet that is the time we were at the end point of buying the medicines, because we got money from World Bank and we bought vaccines. When we got those vaccines, people were, the risk perception had changed. They remained idle in the facilities until they expired. Actually, NMS had really big task to retrieve all these vaccines and destroy, because they didn't have even additional money to do that. And so that's the only area of the vaccine I know that COVID vaccines came in the country and people did not want to have them again, and they remained in the facilities.
PS and Honorable Minister and colleagues, I'm privileged. That time I was working with WHO.
Yes.
Many countries received these vaccines with very short life, and actually they expired, most countries. But Uganda is among the countries that actually used a huge bulk of vaccines that had very short life. This I can empirically speak because I was working with WHO and were monitoring all these vaccination issues. But Honorable Namboze, your point was very well noted as you spoke from the viewpoint of the Auditor General's recommendations in the Auditor General's report. And the clarification has been given ably by the PS. Let's proceed.
So the HPV vaccine and other vaccine, the risk perception and also continuous education, we do that. And that's why even yesterday we were engaging the members of parliament to talk about, and what is a challenge is to have our continued engagement on the radio and TV, because every time we book, we are expected to pay. Yet our budget for that component is never enough. Only we get money like when we are going to have campaign, because a partner supports. When they don't support, we don't have the budget for continuous engagement and sensitization. But whenever we get opportunity, we go to these radios and TV and social media to continue to educate where we can. But where we are limited with resources, that's what happens, that we are not constant. On the universal health coverage, we are at 49, and our target is 65. But we do believe that we continued funding, because you see, universal health coverage, there are many areas they assess. And one of them is the human resource. We still have a gross understaffing. We cannot achieve universal health coverage as our target unless that issue is. We cannot achieve universal health coverage if we are not able to vaccinate all our children 100%. We cannot get to universal health coverage if the disease burden, the TB, HIV, malaria is still high. What do we need to do? We need to invest more in prevention to make sure that they come down. We cannot achieve universal health coverage if we are still talking about open defecation as a country. We can't. So there are certain things that we must address in order to achieve that index. On HIV, our area where we are not performing above 95 is the first 95. And where are the pockets? The adolescent men, we are not picking men who have, although recently it has improved, but, and also young people between 0 to 9. So if we are able to do more self-testing, if we are able to search those special pockets and test more, because we are still at 86, we've not reached 95, meaning we are still missing some people in the community. The charges came about, and I think when the hospitals come here, they'll be able to talk more about private versus the general and the method of giving of exceptions. We put mechanism in hospitals to give exceptions. If you come and you are poor, you are supposed to be exempted and they give you free service. By the way, there is no free service. Even those ones where they give free service, government pays. It's just that it's a misnomer, it's free service. No, every service is costed in a hospital. It's just because that the other one where you don't pay, government pays. But the money that we are charging, for example, for the CT scan, is because the expense of maintenance is extremely high. The money we get, for example, to run those CT scan is far ahead of what we get. For maintenance of entire equipment in the whole country, we get, I think, up to 2.8 billion. Only CT scans, without X-ray, without ultrasound, without ICU equipment, without lab equipment, only CT scan, I need 4.8 billion per year. And that is just maintenance. But when, like now I have a machine that broke down in Arua, that it requires 500 million to replace that, but I don't have that money. So what does it mean? So the cost of maintenance of some of this equipment, the cost of making sure that we have power continuously, and because we have had the problem of higher bills, oxygen machines that we bought, they are big guzzlers of power. Oxygen plants. Yet the money we receive is a quarter of what is needed. So what happens? They are trying to find money to keep these services going. And I think when the hospitals come here, they'll be able to elaborate more, because I don't have those details. But the principle is to meet the gap where government is not able. I do believe that once we get into national health insurance, some of those gaps will be bridged, and we'll be able to sort that. That refugee hosting communities or districts are priorities, but we work together with UNHCR. The money is not enough. It is not possible to say let's only concentrate on regions that are hosting and then we forget about. So we spread the resources equally, because everyone matters, including the Ugandans in those refugee hosting communities. So the sub-counties that you talked about in Kotido, they are part of the upgrades that we are planning. Mbale, next year we have got a project that is going to give us money to finish that structure. We have every year it has been on our list, but we never get, and not only Mbale, but even Fort Poto, even Arua, even Mubende. We have so many structures that we have not finished, including the one we had started on under World Bank, that the project ended and we did not finish. We have put them in the next project. And once we get the money, hopefully next year, those are the projects we are going to begin with as the first priority to make sure they're all completed. So I think that's what I have. The structure we shall provide to you, the new structure. Yeah. So additional regional referral hospitals, and we have been planning that Mbarara, Gulu, and Mbale become national referral, but it remained in a dream because you can't just upgrade without resources. What was stopping us is to have the money. The regional referral hospital, Kapchora, has been on our list for more than 6 years to upgrade, but we didn't have money. Now there are other regional referral like Tororo. They were also proposing. All that will be possible once we get the resources. But we have them on our list. They are priority. It's just that it was a matter of resource availability. Now the waste management cost, we have costed what it takes to manage. But you see, we are not working alone. We have local government, we have city authorities, and we are working. First of all, it's going to be a bit manageable once people know that we need to sort waste, because plastics can be taken and recycled. So that should not be part of the big bulk of the waste that is being taken. The biodegradable can be taken in and put in the gardens or in the compost pit, and that will reduce. Once we teach our people over time, that bulk of the waste that poured on the road, for us we see that was a bad thing. It was a bad, good issue, because we picked all the waste from the homes, from the places, and they were on the street. But now we are going to handle the waste from the street and take it away and teach our people to manage the waste. That is everyone's responsibility, and we ask the members of Parliament here, help us also to amplify that voice. Thank you very much.
Thank you, PS. A big round of applause to the PS.
The PET scan, the construction is ongoing, and maybe we can leave here the director of cancer to continue just in case they have. But that construction also delayed because they didn't have the money. You know, the money for the loan, it took a long time. They have just secured money and they are constructing. PET scan is not just an ordinary machine. You have to construct a very, very highly specialized area to manage that. So the construction is ongoing. Once that is done, the PET scan will be brought and people will not be going to Nairobi.
Thank you. Thank you. Yep. Prof, over to you.
Chair, thank you. I wanted to make just comment on 2 areas. One of it is that we need to have a strategic shift from the curative to prevention. So whereas we definitely need hospitals, that's a fact, because as population lives longer, people need what? The services. Because we know that the burden of disease, actually if you do analysis, probably we'll come back next time and do analysis, that what is that which is bringing many people to these facilities, you'll find that most of the conditions actually will be what? Are preventable. Almost over 50–60%. So we need investment on how people can be able to take care of themselves. We are talking of aspect of self-care, but also as we know that, like us here in this room, as Magno will tell you that 1 in 4 of us has got high blood pressure, but 80% of them do not do what? Do not know. So if we can get people get to know that they have high blood pressure and they get into treatment, then they're okay. But also what we find that only 20% of the people are well controlled, even if they have what? So I think those are things which we need to be able to. So I wanted just comment on that. Whereas we need hospital, we need also to drive, engage community health system. This cleaning days is part of that, of sanitation. The other second aspect which I wanted to make comment, Chair, is regarding the aspect which about hospitals upgrade, partially about Mukono. Hospitals, what constitutes them? And I wanted to bring from the comment that initially upgrades were being driven politically, so that everybody wants to announce that you announce this facility that it has been upgraded. And actually Mukono was one of those ones where the political what? An upgrade was what? But what we now do is that we need to put in all what you require before actually, from those lessons, we're now going back to look that you need to put in all what you require, put the necessary infrastructure, put the necessary human resources, put the data information health systems, the diagnostics and imaging, and then you can be able to upgrade the facilities. Otherwise, you will find that you will have the upgrade, you will have it in by name, but it does not able to meet what? The services. But despite that, I want to recognize that Mukono is one of our well-performing hospitals. Actually, if you visit the, you can have a clap, much bigger clap for that. If you visit the PNFP on the other side, you can find that there is no bed in the Mukono hospital. But I mean, all of them are full and people even are on the floor. But even if you tell them to go to the neighboring hospital, they will not willing to do what? To go. And that's why, Chair, I wanted that we can only solve this problem when we have national insurance. Because if now Mukono Health Center, Protestant Church was able to have patients and they are compensated for that, then patients will be distributed. And then these pressures which we have are not what? So that's what it takes. You need the infrastructure, and we have service standards. One of the service standards for a general hospital, for instance, we revised the structure from about 170 to now over 350. So that's in terms of human resources, that's what you require. We are putting now consultants at general hospitals. So if you look at the current structure of general hospitals, it's like the structure which was for regional referral hospital. If you look at the one at regional hospital, is now the structure which was at Mulago. So the regional hospitals are like a mini what? A mini hospital. So now that's why one of the key aspects we are looking at that, how can we get funding so that we can drive the human resource from the 33% to the 55%, which the NDP4 says that we should, by 2030, at least we should be at what? 35%. I also want to mention that when we did the restructuring, Honorable Chair, is that, and members, we try to estimate to the best estimate, because if you look at the population of a sub-district, we put in that there should be 5 doctors, and it has got a population of 100, so that we try to reduce the what? The number of doctor to patient what? When it comes to nurses, we know very well that for every 5 beds, there should be 1 nurse on shift. So those are the yardsticks which, when we reviewed them, so it was based on a scientific what? Benchmarks. But now, this structure will definitely take us some period of time to do what? To fill it. And we need resources for that. The last aspect here also which I wanted that which we haven't mentioned is specialized training. We do not have funding for specialized what? Training. And yet the government has invested a lot in, like now you have Uganda Cancer Institute, Uganda Heart Institute, the Lubowa Hospital, the Aga Khan Hospital is coming. So all those hospitals need specialists and super specialists. But we need to have money for what? For specialized and super specialized training. We have been trying to speak to our colleagues in education that why don't we shift probably 10% of the sponsor budget for training which they have from the other courses now to specialized what? Training. So those are really the discussion, but probably if you add your voice, probably they will do what? Because they only have money for basic what? Training. They don't have money for what? Specialized training. Thank you, Chair.
Beautiful. A round of applause to Prof. Olaro. Yeah, these are very well noted, and indeed some of our objectives for this meeting are being met. So some of the silent issues that actually wanted to listen to and then see how we position the committee to support some of these very good ideas that you actually have. for the betterment of the population. All right.
Thank you very much, Chair. Thank you for my seniors for speaking. One more important thing which you mentioned, which we have to take up, is prevention of drowning as a program. Because what you hear from the lectures is something which is a multi-sectoral approach that we need to take up, because then we don't want to lose Ugandans due to drowning. So, thank you.
Thank you. So, so Honorable Minister, we shall allow you to go.
Honorable Chair.
But we shall remain with your team, and indeed some of the issues
Honorable
like
Chair, before he leaves,
one second, Honorable. One second. The issue of the mortuary was ably responded to. That the technical...
He has not. It is an emergency, Honorable Minister, because we have unclaimed bodies which have caused a lot of smell in the hospital, and we don't have a fridge. It is really emergency.
Honorable Minister, Honorable Member, the Minister stated that they have taken note on the issues of mortuaries and the rest. And besides, he ably referred to the technical colleagues concerned.
Procedure, Honorable Chair.
Of it.
Procedure.
So,
there's a procedure here, Honorable Chair.
Look at the challenge the MPs raising. Then we see what can be done.
Correct.
You allow us, those who are going for State House meeting, to go. For those who are not going,
there is a procedure. Yes. Thank you, Honorable Chair. There are some of us, members of this committee, who have come a little late. I was requesting whether it's procedurally right to give us an opportunity to introduce ourselves, such that the meeting gets it on record.
You are very right. You are very right procedurally, and we shall allow the team to take leave at will. But maybe for the colleagues who came in when we had already started, we can start right away with yourself to introduce yourself.
Honorable Chair, colleagues and the Minister and your team, I'm Dr. Batua Timothy Lusala. I'm the Shadow Minister of Health. I had earlier come with my permanent secretary and the heads of various departments and my budget and a very huge fleet, but I was alerted that the space is not enough in this room. Yeah, so that's why I'm here alone, but I'm glad to receive you. Thank you very much.
And the shadow. That's very team on Monday. Most importantly, the departments that have not been able to turn up today, we have given them an opportunity to attend on Monday. So, same time, but we shall communicate the meeting place in due course. So, honorable members and our senior technical team, we surely thank you and would wish to proceed. If there are other issues, take note. And again, for the record, you can either provide a response or you can plan to give us a response in writing. We'll still take good note of them. We have the colleagues, the heads of departments and other institutions. Possibly would give you an opportunity and then we listen to you. We also have National Medical Stores with us. We'll also give you an opportunity and very, very briefly we listen from you. But I would love to, if you'd agree with me, to start with National Medical Stores very briefly, and then we come to the departments, Heart Institute, Cancer Institute, and then the colleagues.
Honorable Chair.
And blood.
Okay.
And then
I also have a suggestion that we listen to UBTS because blood. No, I'm not. Yes. Okay.
So, one second. So, the presentation is loaded. If you can summarize it in 5 minutes, that will be good. Over to you for the presentation. Thank you.
Do you read me well? Chair, a very good afternoon to you and honorable members. My name is Paul Okware. I am the Chief Stores and Operations Officer at National Medical Stores, standing in for the General Manager who could make it today. I'm here with my colleague, Apollo Wesije, who is our Corporation Secretary. We'll be trying to make a presentation on the activities of National Medical Stores to try and highlight what we do, how we function, how the governance structure works, highlights that I think members of this committee here should be aware of, and the areas where we're trying to innovate and make improvements in the health supply chain in the country. First of all, to provide some sort of insight into the stewardship and governance of the corporation. The overall stewardship of the corporation is entrusted to the board of directors who are appointed and report to the Minister of Health, while the day-to-day operations of the corporation are handled by the general manager. Oversight for this entity is provided by the Ministry of Health, whom we've been here today, accompanying them, COSASE, and as well as the Committee of Health, like we're here today. All our procurements are handled by PPDA, but we're also audited annually by the Auditor General, and I'm sure you do get reports in that same regard. If we could move to the next one. Someone is moved very fast, yeah? Just go one at a time. Yeah. So, important to note is that we are a vote and we do receive funds from the central coffers of government of Uganda, and we do charge a service fee for the services we offer, and that is to a percentage of 7%. And this has come down from 35% when we used to basically self-finance ourselves. So we are here to report that the move to make sure that we can do pooled procurement and the money for public health commodities is pooled to National Medical Stores is working very well. There is a level of efficiency that we have, which is reflected in that service fee that we're charging right now. We also have systems in place which can allow us process emergency orders over 24 hours. We're able to do this by having 2 shifts of work. So that organization you see working in Entebbe and Kajansi basically is working 24 hours, try and make sure we have commodities available in our health facilities. We are supporting so many partners over and above government of Uganda. We're working with the US government, Global Fund, UNICEF, Gavi, the World Bank, and many others, even for epidemic response, but also to support the programs we have in the country to provide commodities for basic diseases that we have. We also have extensive interactions with health facilities across the country. We make at least 6 deliveries to each health facility every financial year, but we also have engagements with them where we do the planning activities for the commodities they shall be receiving throughout the year. For the Center 2s and 3s, we develop with them what we call basic kits. These are district-specific kits where we design and agree the composition of commodities they'll be receiving during their cycle orders, and try and make sure that that is properly understood and articulated, which we know can be unique and different to other districts. We have a total of 3,508 facilities that we are serving right now. The Center 2s and 3s still do provide the bulk of the facilities in terms of sheer numbers, and they constitute more than 98% of the facilities that we're serving. They are numerous in number, but the coverage is much higher. The general hospitals are a bit fewer. Those are just about 53, and you'll find the number is reducing. We work also with the Ministry of Health extensively when it comes to emergencies and outbreaks like Ebola, like we're seeing right now, and COVID in the past, and also interventions for other campaigns or health interventions that may be important to us. In order to get closer to our clients, we have established 10 regional offices across the country. These are not warehouses or stores where we have commodities. These are more of liaison offices where we have technical staff who can get closer to our clients to appreciate their demand and also to assess the quality of service that we're offering and keep challenging us to make sure that we can be a little bit closer and offer a better service that meets the needs of the clients that we have. Our total throughput for last financial year was a total of 1.8 billion Uganda shillings, and almost 50% of that came through financing from the government of Uganda, and the rest was from partners, which is quite an improvement. We served 3,508 health facilities, but I think what we also need to congratulate ourselves on is that when we compare the level of financing we are getting from government and from partners with other countries in the region, we are far ahead of them. Some of them still are finding their governments only financing 20, 25%, barely even 30% of the entire budget for commodities. Uganda actually is leading in the region, and I think it's a very good example. We are hoping that momentum can continue. Okay. We have a distribution model here where we have a routinized way of distributing commodities across the country. We have divided the country into 4 distinct regions, basically zone 1, 2, 3, 4, and we schedule each of their deliveries according to that plan that we have seen pinned up there. So when you make your visits to health facilities across the country, you will see many of these posters put up like that. They are very important. Please take interest in them. This is what basically is our charter with our clients. In it, in column, that would be column 1, 2, 3, 4 there, you will have an order deadline date, which is a very important date. We are committing that if a facility can place its order with NMS by that date, there is a commitment from NMS that we shall deliver by the date that you will find in the last column there. So, for example, if you just go back to that, that's an important one I want us to look at. So, it's important for us to appreciate that there is a certain rhythm to the way we are asking facilities to order for commodities and a rhythm to which we are actually delivering these commodities. And you find the order lead time between those dates will be about a month. So sometimes people may say, oh, you've delivered and we are late, we are running out. Always look at this schedule here and ask yourself, is NMS late or has the date arrived yet? It's very, very important for us to have this appreciation. We can go to the next one. Last mile delivery is also a very important aspect of the operations that we have. This is a mechanism of transporting commodities to the final end user. It is commonplace in many other areas of logistics and commerce, but in health supply chain it's also very important for us. We adopted it in 2012 when we realized that many of the medicines we were taking down to the districts were not being conveyed to the final users, and we looked for resources internal here to find ways of making sure we could support the in-district